Welcome to the weekly checkup presented by Wellstar Health System. I'm Belinda Skelton. This week, we're joined by our friends at Virtual Imaging. And in the studio, we have Mike Warren, who is a patient advocate at Virtual Imaging. Mike, thanks for taking your Sunday to join us on the weekly checkup.
Oh, thank you, Belinda. It's great to be here.
All right, let's dive in and talk to the audience about what Virtual Imaging is all about.
So, Belinda, Virtual Imaging is an Atlanta-based medical imaging company. Been in business for about 15 years, and we offer safe, easy, and high-resolution CT scans for the early detection of things like heart disease, cancer, and neurological issues such as stroke and dementia. Our primary mission is to help people avoid premature death by identifying serious health issues such as cancer and heart disease at their earliest stages, and we identify those problems months or even years before you would show symptoms. And we are a local family-owned business.
I love that you're a family-owned business. That I grew up in a family-owned business, and that means a lot to me, and I think it means a lot to those in the community that you are family-owned, and it just means you have a little bit more heart to you.
We do. We're not owned by a hedge fund. We don't have layers of bureaucracy. We're not part of a Fortune 500 company. I have the owner's number on my phone. If there's anything that I need to do that's in the best interest of a patient, I can just always call him, and he almost always says yes.
Oh, I like that. All right, we want to kick off the hour with telling everybody we have a wonderful offer that we're going to be sharing throughout the show. A core body scan for $9.95 for an individual. And we're going to be telling you what a core body scan is. But you need to call 770-678-SCAN. That's 770-678-SCAN. So, Mike, tell the listeners exactly what a core body scan is.
Yeah, absolutely. But I want to let people know that it is important that they go ahead and call. So this is a limited promotion. This was supposed to end in June.
Oh, yeah. We talked about this the last show.
That's right. It was supposed to be over. And we just cannot keep up with the people who are calling.
That's
so just
awesome.
Out of fairness, we've decided to extend it. We set aside a certain number of slots for July. We're down to the last 32. So this is going to be it. Once these 32 slots are taken, the promotion will be over. We're going to end it at the end of the month or when we get the 32 slots filled, which will likely happen before the show ends today. So if you're interested in this promotion, then call now. It's $9.95. That is a $1,500 savings. This would normally cost you $2,500.
Wow. So you're saving actually $1,500 on this core body scan.
Yeah, it's normally $2,500 to do a core body scan.
Okay. So what is a core body scan?
So the core body scan, it's so comprehensive that it would take me 10 minutes to explain it, but I'm going to try and summarize it. It covers everything from your collarbone to your pelvic bone.
Okay.
We're looking for most of the things that kill people in the United States: cancer, heart disease, lung disease, liver disease, kidney disease, and on and on. If I were to print it out on that perforated computer paper, someone actually did this in our office once, by the way, and it went from the top of the ceiling all the way down to the floor and about 2 feet out on the floor for the things we're looking for.
Right.
But we're looking at every organ in the body. This, by the way, is Virtual Imaging's signature scan. It's the scan that saved thousands of lives and needless suffering over the past 15 years. If you've ever listened to WSB and heard the testimonials about someone's life being saved, this is what they're talking about. This is the scan that did that. With traditional health care, I don't know if our listeners know this, but they only screen you, do early detection screening for 4 types of cancer. And even that's overstated because 3 of those are gender specific. But those 4 types of cancer are breast, cervical, prostate, and colon. That's it. Everything else is going to be based on you showing symptoms. But with our core body scan, we're screening for more than 100 types of cancer, and we're looking for all of those at their earliest stages.
And from the collarbone to the pelvic bone, that's the general area that everything is going to happen.
For the most part, absolutely. When you're talking about heart disease, you're talking about issues with your lung, kidney disease, liver disease, and most types of cancer are going to be in the torso, in the core body.
And you can find early detection of those diseases for $9.95, folks. Please take us up on this offer. We're saving you $1,500 today on that. There's 32 slots open. And when those are filled, Mike says those are done. I can't twist his arm on this. So the number to call is 770-678-SCAN. That's 770-678-SCAN. Now, at Virtual Imaging, when you go in and have a scan, you don't just go in, have a scan, and that's it. You are assigned a patient advocate, such as yourself. So what does the patient advocate do?
Well, first of all, Belinda, you've got to realize that this is an awful lot of information that you're going to be provided.
Oh, tremendous.
And that information is not going to be any value to you if you don't know how to interpret it, if you don't understand the information that you're going to receive. So I'm a patient advocate, and my most important responsibility is to ensure that the people who visit our clinics get the most out of those visits. So we don't just put you on a scanner and kick you out the door when you're finished. So each visitor is assigned a patient advocate who reviews your medical concerns and your family history and helps to explain how our scans address those concerns. We explain the technology and review sample reports to ensure you understand the information you receive and how it was developed. And the patient advocate will give you their contact information before you leave so that if you have any questions once you receive the reports or if there are any issues, you can call the patient advocate and they'll be happy to help. So this is nothing like your typical doctor visit where you get about 5 minutes of face-to-face interaction with the doctor. We take whatever time is necessary to make sure your questions are answered and your concerns are addressed. You are not on the clock, and I can vouch for the fact that as a patient advocate, I do not have a time limit with you. I can spend as much time as you want to spend with me.
Okay. So say on my core body scan, the heart shows I have calcification somewhere. Am I going to get a phone call from someone rather quickly on this, or what happens next?
Well, it's going to depend on how serious it is. So we have a threshold. Now, you're talking specifically about the coronary calcium score report at this point. So we have a threshold for that, where any score over 300 we consider to be an extensive plaque burden. Those are kicked out. And typically, we are going to have someone, maybe our cardiologist or maybe someone at our office is going to call you to make you aware that you do have a high number. Now, there's no upper limit on a calcium score, so the higher the number, the greater the sense of urgency. Mm-hmm. But we do have a policy for any scores over 300. Someone from our office or someone affiliated with us is going to call you to discuss that, to give you some suggestions on what you should do next.
See, that's what I love about these scans and virtual imaging. You're not just given the information and say, okay, have a nice day. You're given a roadmap on what to do next.
Yeah, you're going to be given a roadmap in the radiology report. But then beyond that, if you need further assistance, we're going to be there to guide you. But in that radiology report, if there's a specific issue that needs further attention, then our radiologist, Dr. Tom Atlas, is going to specify the type of doctor you need to see. So, for example, if you've got a lung issue, he's going to refer you to a pulmonologist. But then again, like I said, you can always call the patient advocate if you need any further assistance. We just want to make sure if there's something wrong that we're doing whatever we can to help you get treatment for it.
And like you said, it's nothing like your typical doctor visit where you get 5 minutes. You're given the amount of time you need because you take family history into account. You take their current physical condition into account. You get as much information before the test as possible.
Right. So they have some intake paperwork that they fill out when they come in. It's several pages. They'll talk about things like their cholesterol level, if they've ever been diagnosed with heart disease or cancer. And then there's a section of that paperwork where they talk about their family history. And we really want to zero in on that because for a lot of the things that we're looking for when you start talking about heart disease and cancer, there's a very strong genetic component to that. If every man in your family, your father and all of your uncles have all had a heart attack in their 50s, there's a reason for that. So yes, your family history is important. We want to find out if you do have some issues that could be genetic, that could be related to that, so that we can zero in on those things and make sure that you understand how what we're going to do will relate to that.
You know, I've said this in prior shows. All the men on my dad's side of the family have had heart attacks in their 50s. So I'm genetically predisposed in some capacity to heart disease. So I make sure that I get tested every year at Virtual Imaging. Luckily, knock on wood, I've been a 0 thus far, but I will continue to get tested through Virtual Imaging because I have this genetic predisposition. But as we've said over and over, you cannot judge a book by its cover.
No, absolutely not. And I've learned that from my position as a patient advocate. I've had people who come in there who are literally triathletes, and they have heart disease.
Mm-hmm.
I have people who have every reason to believe that they're perfectly healthy, and they're relatively young, maybe they're in their 40s. No reason whatsoever to think there's anything wrong with them, and it turns out they have a serious illness of some type. Now, just because you feel healthy, just because you look healthy, that's no guarantee. And you have to realize we're not looking for tumors when we do the scan. We're looking for the nodules, polyps, and cysts that may someday become tumors. We're trying to catch things before we've even properly designated as, say, stage 1 cancer. So when we can find things at their earliest stages like that, we're going to be able to tell you that, no, you're not as healthy as you think you are, but fortunately we have found this early enough that it's not going to threaten your life.
Right. And that's why we want you to take us up on this offer so we can find things in their earliest stages. And that offer is for $995 for an individual for the core body scan, saving you $1,500 on this. And we have 32 slots available as of right now. Call 770-678-SCAN. That's 770-678-SCAN. All right. Thank you, Mike Warren. You'll be with us throughout the rest of the show. You're listening to the Weekly Checkup only on 95.5 WSB. And we're back on the Weekly Checkup presented by Wellstar Health System. I'm Belinda Skelton. Our show is produced by Lens, Atlanta's healthcare marketing experts. This week, we're joined by our friends at Virtual Imaging. And in the studio, we have Mike Warren. He's a patient advocate at Virtual Imaging. Mike, we've been talking about how important it is to get that baseline test to see if you have anything going on. And the best way to do that is to take us up on this core body scan. And the special we have going on this week is the $995 for an individual core body scan. And we have, when we started the show, we had 32 slots. We don't know as the show progresses how many slots we have available, but they can call 770-678-SCAN. That's 770-678-SCAN. And you might be saying to yourself, Belinda, that is $995. That's a lot of money. But think about your health, folks. If you could turn back the hands of time, if you were able to find a cancer early before it became a stage 1,
right?
Wouldn't you pay $995?
Well, by the way, I have a slide that I use at the office. The first year's out-of-pocket expenses, in other words, the things that aren't paid by health insurance for stage 1 cancer, is $25,000. And you're going to count yourself lucky if you discover cancer at stage 1. From there, it stair steps about another $25,000 for each successive stage.
I'm surprised it's not more than that, to be honest with you, Mike.
And there may be some inflation in the past few years that's not reflected in my slide. But $995 is a tremendous bargain. especially if we find something, because we're going to find it potentially when it's precancerous, when it's still just a nodule, polyp, or a cyst, and you're going to be able to get a treatment for it that's going to be much more affordable than once it becomes cancer. But the other thing is the ability to, if nothing else, get some peace of mind.
Oh, absolutely. What if you paid $995 and the scan came back completely clean? What peace of mind that gives you.
I've never had anyone buy a scan who came back and said that we didn't find anything and they wasted their money.
Oh, absolutely.
Everyone says, oh, this was a bargain for the peace of mind that I got just knowing that I don't have anything growing in there, that I don't have serious heart disease, that I don't have kidney failure or liver failure in my future. So if nothing else, you will get a tremendous peace of mind from this.
So today, call 770-678-SCAN for that $995 core body scan. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup. I'm Belinda Skelton. Our show is produced by Wellstar Health System and sponsored by the Georgia Trauma Foundation, investing in trauma care to save lives, Olansky Dermatology and Aesthetics, offering the highest quality in medical, surgical, and cosmetic dermatology, Avant Gynecology, Atlanta's GYN and surgical specialist, virtual imaging, EBT screening for cancer and cardiovascular disease. This week, we're joined by our friends at Virtual Imaging, and Mike Warren, who is a patient advocate at Virtual Imaging, is joining us in the studio. Mike, so if people want to take advantage of the different options that Virtual Imaging has to offer, we want to tell them about the payment options that are available to them.
Right. And, of course, today we're running this special for $995 for an individual to get a core body scan that's going to scan them from their collarbones to their pelvis bones. And, yes, there are a number of different ways to pay for this. First of all, we accept just about any type of credit card, but we're also HSA, which is Health Savings Account, and FSA, Flexible Spending Account, eligible. We are an approved medical expense for those programs, so if you have those programs, you can use them both for today's special, the $995 core body scan special, or you can use them for any of our services. And you have to understand that the benefits of many of these savings accounts expire if you don't use them.
Mm-hmm.
So this is an excellent opportunity to put those benefits to use before they're either gone or you've squandered them on products or services that you don't need. I remember I met with a guy one time that said he was about to buy a case of Band-Aids from Amazon.
Case of Band-Aids.
Just to burn his FSA benefits so they wouldn't go to waste. So don't do that. So call now at 770-678-SCAN to put those benefits to use for something that could save your life.
Now, you have memberships. Let's talk about the memberships that Virtual Imaging has.
We do. So with memberships, and we've got about 12,000 of these members, by the way, and these are people who scan regularly with us, usually every year. And they do this so that we can monitor their overall health and identify serious issues such as heart disease and cancer as soon as they appear. So, of course, if we're trying to see things at their earliest stages, then we need to see you regularly so that when that thing develops, we're able to see it. But on top of that, regular scanning allows us to establish baselines so that we can use to help you make well-informed decisions about your health and wellness. The baselines also give us more insight.
And that would be the first screening, what we're calling a baseline.
The first screening would be the baseline for year 2. The year 2 screening would be the baseline for year 3, and so on and so forth. But that gives us critical insight, for example, information about the rates of growth. Now, like I said, we're looking for nodules, polyps, and cysts, but you have many nodules, polyps, and cysts that are perfectly harmless. So if we see something, 2-centimeter polyp in the lining of the stomach, it's not necessarily a red flag, but if we had the benefit of being able to go back and look at the previous year's scan, was that either not there at all, or maybe it was there and it was only 2 millimeters? So now it's grown pretty dramatically in size over a period of time.
Mm-hmm.
And that helps us to get better insight into what may be going on there. So both the benefits of seeing things as they develop and the benefits of getting the baseline and being able to see things year over year, it just gives us more pieces to that puzzle and helps you better understand your health and wellness.
As I've said in shows prior, my primary care physician loves that I'm a member of Virtual Imaging and get a full body scan every year. It just completes the picture for him. He can only do so much, and this lets him see inside and see things that he can't see and gives him a complete picture of my health.
Right. Well, the only thing he can really do, or for his purposes, for what we're doing with regular scanning, is wait around for symptoms to show
Right.
up. He can wait until you're coughing up blood and then maybe recognize that there's potentially something going on in your lungs that might be lung cancer. He can wait until you have blood in your urine. He can wait until you have a blinding headache to maybe realize that you've had a stroke. But that's what he's reduced to. With our information, you can take your radiology report to him, and he can take a look at it, and he can see exactly what's going on in all the various tissues of your body and where your problem areas are.
And I get a CD that he gets to look at every year.
We make those available, and that's another benefit of our members. There's hundreds, obviously hundreds of images that we get when we do a scan.
Mm-hmm.
And anytime you take the radiology report to your doctor and he sees the report but wants to get a look at it himself, yes, you're correct. We can make those medical images available to him.
Right. And like you said, once you have a symptom, it could already be a serious problem.
The fact that you have symptoms are an indication that whatever's wrong with you is already taking a toll. It's already making you sick. So what most people know about their health is going to be based on their annual physicals, and that's going to give you information about your blood pressure, your cholesterol levels, and a few other vital statistics, but that's only the tip of the iceberg. So there's many things that are going on inside of you that a routine physical would never reveal, and again, you're just going to wait for those symptoms. So let's say, for example, one of your symptoms is, as I mentioned a moment ago, you're coughing up blood. Obviously, whatever that problem is, and let's say it's a tumor, it's gotten to the point where it's caused deterioration of the lung tissue. So just by definition, it's already at an advanced stage, or it wouldn't be causing you physical harm.
Mm-hmm.
But the size of the things that we're looking for, we can go all the way down to things the size of a BB. There's really nothing the size of a BB that's going to kill you.
Right. And when you detect something the size of a BB, your choices are great.
Absolutely. So not only do you have a much greater probability for a positive outcome, but you have a much wider range of treatment options. You're going to be given alternatives.
Sure.
We can do this, or we can do this other thing. And it's a triangle. I have a graphic of it that I use at the office that it just shows that your treatment options funnel down as your condition gets worse. And the other thing is, not only are there more treatment options, they're cheaper.
Right.
Those treatment options for precancerous or stage 1 there are more of them, and they're a lot cheaper than the treatment options once you get to stage 3 or stage 4.
And we hate to put a price tag on it because your health is the most important thing, but so many people are devastated by the price of traumatic health issues.
Oh, absolutely. 2/3, 66% of bankruptcy filings in the United States are due to medical expenses.
And that's just insult to injury.
No, not only does it rob you of your life, it robs you of your life savings, and then you die, and all you leave your family is a big pile of unpaid medical bills.
Right.
And it happens. That's not hypothetical. That happens all the time in the United States.
Right. It's so sad. So what we're trying to do is get you to call 770-678-SCAN. That's 770-678-SCAN for this core body scan $9.95 is what you'll pay, and I want you to go over what the core body scan is again, Mike, so people will know what they're getting for that $9.95.
Sure. Yeah, it covers everything from your collarbones to your pelvis. So it's the torso. And we're going to look for the most common things that kill people in the United States: cancer, heart disease, lung disease, liver disease, kidney disease, and so on and so on. We also see things like aneurysms, so aortic aneurysms, thoracic and abdominal aneurysms, but just any number of issues that would be in your viscera, in your torso, that could threaten your life.
Okay, and for your health and your well-being, $9.95 is a steal for your well-being, and you're saving today $1,500 on that per individual. And please call 770-678-SCAN. That's 770-678-SCAN. And how long does it take, Mike, once you walk in the front door of virtual imaging until you're walking out for this to take place?
Well, we always tell people to allow 90 minutes. Most of that is going to be that we're allowing however much time you want to spend with the patient advocate. The time on the scanner is less than 5 minutes.
Oh, yeah.
I mean, it's an open platform, by the way. It's extremely unusual for anyone to tell me that they've experienced any sort of trauma or stress from that scan. But 90 minutes, set that time aside. You're going to come in. You're going to fill out the intake paperwork. You're going to meet with the patient advocate. They're going to answer whatever questions you have. And as I mentioned in the last segment, we're going to talk about any symptoms or issues you're having, your family history, that sort of thing. I don't know what anyone has going on, but the day you come in and do a core body scan, that's the most important thing you're going to do that day.
Absolutely. I know you're busy and you have a lot going on. Everybody does. But this is your health, folks. And when you don't have your health, you have nothing.
Oh, there's an old saying that you've got 1,000 problems until you have a serious health issue, and then you only have one problem.
Absolutely. That's 770-678-SCAN. That's 770-678-SCAN. $9.95. Do it for your health. Do it for your loved ones. Core body scan with virtual imaging. We're going to take a break. When we come back, we're going to talk more of the benefits of a full body scan and what virtual imaging can do for you. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup. I'm Belinda Skelton. Our show is presented by WellStar Health System. At WellStar, the patient is at the center of everything they do. WellStar is nationally ranked and locally recognized for its high-quality care, inclusive culture, exceptional doctors and caregivers, and one of the largest and most integrated healthcare systems in Georgia. Thank you for tuning in this week and joining us and our friends at Virtual Imaging. And thanks to Mike Warren of Virtual Imaging, who is a patient advocate, for sitting in the studio with us today. Mike, we have a great offer on the table we want to remind our listeners of, because we only have a few slots left, and when those go, this promotion is over. So tell our listeners about it.
So today we're offering a core body scan, which is going to cover everything from your collarbones to your pelvis bones, for $995. This is normally $2,500, so this is a $1,500 savings, and take advantage of that. You need to call our call center. They're standing by at 770-678-SCAN. Now, this promotion was scheduled to end in June, but we've opened up some more slots in July due to overwhelming demand. When we started the show, we had 30 slots left. I have not gotten an update from the call center, but I would assume that we don't have that many remaining now. But once these slots are taken, this promotion is over. And we will likely fill all the remaining slots before the show ends today. So if you want to take advantage of this promotion, don't wait.
Right.
Go ahead and call now. Now, by the way, you do not have to talk to a call center representative. there's probably not going to be available because we're going to be getting so many calls during the show. All you need to do is leave a message. If you leave a message, that will be date and time stamped, and your slot will be reserved. Someone will just call you back later. But right now, you got to realize we got more people calling than we have call center reps. It's very likely you're going to get the answering machine.
And leaving more, you said answering machine. How old are you, Mike?
I just showed you my age, didn't it?
No, but calling more than once will not help. So
No,
just leave
it's
one
not
message
necessary.
and you're good. But we want to give you that number again, and that's 770-678-SCAN. That's 770-678-SCAN for the core body scan of $9.95. This is a tremendous offer that's not going to last very long, so take us up on it. We're going to take a break. We'll be back for the final hour of the weekly checkup. You're listening to 95.5 WSB. And welcome back to the second hour of the weekly checkup presented by WellStar Health System. I'm Belinda Skelton. This week, we're joined by our friends at Virtual Imaging. And in the studio, we have patient advocate at Virtual Imaging, Mike Warren. Mike, we have a core body scan for $9.95 as our special offer. I want to get that right up front for folks who want that to call 770-678-SCAN. That's for $9.95 for an individual. But for about a year and a few months now, Virtual Imaging has been doing a head scan. And that's so exciting to me. Tell us about that.
Yes, we started beta testing the head scans early last year and started offering to our customers, typically our members, when they were coming in for their regular scans a little over a year ago. So I think it was around May of last year that we started doing this on a regular basis. So the core body scan promotion that we're offering right now goes from the collarbones to the pelvis. So it's the torso.
Mm-hmm.
And I've been a patient advocate for a while. And before we started offering head scans, I would say at least half the people I talked to were asking about the head. Why can't we also scan our head? I have as much family history of neurological issues as I do of heart disease and cancer and those types of things. So it was really just based on popular demand. But the head scan just takes the scan all the way to the top of the head. We're looking for things that are any number of different types of neurological issues: dementia, stroke history, fluid on the brain, bleeding in the brain, and of course my favorite, which are brain aneurysms. Yeah, brain aneurysms, because I have the distinction. I was part of that beta testing. The most obvious guinea pigs for the beta test were the staff, the people who worked there, and have the distinction of being the very first brain aneurysm that we discovered.
Well,
at
I don't know if I should say congratulations or I'm sorry, but
it's a
tell us
distinction
about
I
that.
could live without.
Okay.
But yes, they discovered a 7 by 11 millimeter brain aneurysm.
How big?
So it's the dilation, the width, or the amount that it's ballooned out is 7 millimeters, and then that runs 11 millimeters of that artery.
Wow.
So 7 by 11 millimeter brain aneurysm. I had no idea that I had that. I didn't have any symptoms for it. I didn't then, February of last year, and I still don't now.
So you were just doing it so they could practice.
Well, it was good information for me because I wanted to know about my neurological health, but I just certainly expected that it was going to be nothing more than validation that I was as healthy as I believed I was. And the other thing that's such an anomaly is that I have low blood pressure. I took my blood pressure this morning at a Higgy machine at Publix, and it was 101/65.
Oh, wow, that's low.
That is a very typical blood pressure reading for me. And there's normally a correlation between hypertension and high blood pressure and brain aneurysm. So I shouldn't have a brain aneurysm. But apparently my body doesn't realize that, and I have one anyway. But that's just an example of the types of things that we find. But it's a comprehensive neurological evaluation. We also see things like sinusitis and any number of other issues that we're going to find, and problems with the skull bone. If you've ever had any trauma, if that did any brain damage, that will show up.
Wow. It's amazing to me that you can detect early signs of dementia.
We can. What we're looking for there is atrophy of brain tissue. We're looking for an indication that it's starting to shrink. But yes, there are physical manifestations of dementia. And by the way, dementia is an umbrella category that includes Alzheimer's. But there are physical manifestations of that, and one of those is that the brain tissue starts to atrophy.
And do you remember the statistic that you quoted one show about the percentage of people? It was like 45% of people over the age of...
It was a study that came out earlier this year that was pretty widely reported. It said that 43% of the people over the age of 55 are going to get dementia.
That is frightening to me.
That's epidemic. And we probably all have someone in our family.
Oh, absolutely.
I have an aunt that died from dementia last year, and she suffered with that for probably 10 years before she died. She just certainly was not the person I had known my whole life.
Oh, no, it robs you every day.
It really does. So you end up being a body without a brain. But no, dementia is, and I guess part of it is maybe that we're living longer, but dementia is becoming a very serious health issue in the United States. And it's not just a matter of finding out that you've got it just so you get bad news. They've started to develop drugs. There are treatments. There are activities. There are any number of things that you can do now that will slow the progression of dementia. But you're not going to know to go on those treatments or to take advantage of those things if you don't know you have it. So the sooner you can discover it, the sooner you can take action to treat it.
Right. And there are those camps of people that are like, I'd rather not know the information. So I just don't want to know bad news.
Yeah, there are healthy people who will tell you that. But go to an oncology clinic and find someone who's in stage 3 or 4 of cancer and see if they agree with that sentiment. See if they're telling you, well, I really didn't want to know a year and a half ago that I was at stage 1 and could have been treated and could have survived this. It's easy to say when it's abstract. It's easy to say when you convinced yourself that it's something that will never happen to you, that it only happens to other people.
Right.
But once you get that diagnosis, you very much wish that you had gotten that information earlier. The worst thing your doctor can tell you isn't that this is inoperable and there's nothing we can do about it. The worst thing you're going to hear from your doctor is, wish we'd seen this sooner.
Right. And do you remember the testimonial that we had about the lady with the brain tumor that went to her doctor because she felt like she had some symptoms, and he performed some tests on her, but she passed his test?
He did some cognitive tests on her. She was having cognitive issues,
right.
So he did cognitive testing, did not send her in for imaging because he couldn't meet the threshold, apparently, that he needed to get it approved by the health insurance company. And she came in and saw us. I actually met with her. I was her patient advocate, and we discovered a large brain tumor.
If she had not, her life would have been ended had she not gone to virtual imaging.
There's a very good chance. And she was in her early 40s, by the way. She was not an older woman.
No, and she had young children.
She did.
Folks, it's vitally important that you take your health care in your own hands and be your own patient advocate. Call 770-678-SCAN. That's 770-678-SCAN. You have got to take your health in your own hands and be the driver of that bus. If you want a brain scan, if you want to do a membership, and we're going to talk about in just a few minutes the other things that the scans that you can do at virtual imaging. But today we're offering the core body scan for $995 for an individual. That's a $1,500 savings. Call 770-678-SCAN. Now, if you need a colonoscopy and you don't want the traditional method for whatever reason, virtual imaging offers
we have an alternative.
An alternative. Tell us about that.
Yes, what we do is referred to as a virtual colonography. And just like any other medical image we do, we're going to do imaging specific to your colon. Now, this does require prep.
Yeah, you're not getting out of that. You still have to do prep.
I have a lot of people whose eyes light up.
Right.
I tell them we've got an alternative to a colonoscopy, and it's, oh, good, I didn't want to do the prep.
Right.
Well, the bad news is you do still have to prep because we don't want to confuse debris for some other problem. We really can't see the inside of the colon as well as we need to if you have not prepped. But yes, what we were not going to do is put you to sleep, so there's no anesthesia. We're not going to run a 5-foot tube through your colon, so there's no risk that we're going to perforate the colon and you're going to wake up in the hospital. Mm-hmm. We're going to be able to get a good look inside and out.
That's important. Outside. That's what a normal, regular
colonoscopy
does not do.
It cannot see the exterior of the colon, and there can be problems there as well. But we're going to be able to see the entire length of the colon, and not only that, we're also going to be able to see the small intestines.
Oh.
Which obviously you're not going to be able to see that with a colonoscopy. But yes, it is a comprehensive evaluation of your colon. It's a good alternative for colonoscopy if you don't want to be put to sleep, if you don't want to run the risk of having a perforated colon. There's a number of other services that we offer in addition to the core body scan that people can do today for $9.95, and that is one of them.
Okay. Now, let's talk about visceral fat and what that is and why you need to be checked for it.
So there are two types of belly fat. There's the belly fat that lies between the skin and the muscle, which is called subcutaneous fat. And then there's belly fat that's actually inside of your viscera. It's in the gut itself. It surrounds the organs. And these two different types of fat, depending on their location, have completely different implications for your health. So subcutaneous fat, within reason, is more of an aesthetic issue. I mean, if you're carrying around a few extra pounds of subcutaneous fat, your health is not at risk. Visceral fat is a completely different story. If you have that fat surrounding your organs, then that fat tissue is going to release proteins and chemical compounds that are toxic to the organs, and it's going to cause inflammation. Visceral fat is a leading cause of heart disease in the United States. It's a leading cause of dementia. It's a leading cause of premature death, and we have a test that will take care of that.
Oh, excellent. We're going to talk more about that and visceral fat and what virtual imaging can do to test for that when we come back. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup presented by Wellstar Health System. I'm Belinda Skelton. Our show is produced by Lens, Atlanta's healthcare marketing experts. This week, we're joined by our friends at Virtual Imaging. And in the studio, we have Mike Warren, who is a patient advocate at Virtual Imaging. And Mike, let's hit that promotion pretty hard because we have, 40 minutes left in the show?
Yeah, something like that. So the promotion today, just call 770-678-SCAN, and it's $9.95 for a core body scan. It's going to scan everything from your collarbones to your pelvis bones. This is a $1,500 savings. This is normally $2,500. This is a promotion that's supposed to be over with by now. This was supposed to end in June, but we opened up some more slots for the month of July. And when the show started, we had 32 slots left. Once those 32 slots are gone, the promotion is over. I just got a text update from the lady at our call center. We are down to 14.
Oh, that's excellent.
We only have 14 slots remaining, so do not wait. Now, again, you do not have to talk to a call center representative. We've got more people calling than we have people to answer the phone. You can leave a message that will be date and time stamped. You will get credit for that. You do not need to leave multiple messages, or once you've left the message, you're finished. You don't need to call back.
And as Mike says, leave a message on the answering
Call
machine.
it the answering machine because I'm the age that still thinks of things as answering machines.
And he's got the cord wrapped around his hand. And that's 770-678-SCAN. That's 770-678-SCAN. Folks, I urge you. I care about you. I care about your health. I want you to be here with us as long as possible. I've done this scan. I'll tell you, well, I don't have time to tell you the results now, but I'll tell you when we come back the nutshell of my results. It was eye-opening for me, and they they change year to year. That's why it's important you go yearly for these scans, because this past year I had some changes. And I mean, not terrible, but things I need to watch. So it's important that you keep up and keep these yearly scans going and get, like we've talked about throughout the show, a baseline. So that's 770-678-SCAN, 770-678 for a core body scan. You said we've sold 14, or we have 14 left?
No, we only have 14 remaining.
We only have 14 left. So jump on those phones. $9.95 for an individual. We're going to take a break. We'll be back. You're listening to the Weekly Checkup only on 95.5 WSB. And welcome back to the Weekly Checkup. I'm Belinda Skelton. Our show is produced by Wellstar Health System, the largest and most integrated healthcare system in Georgia, and sponsored by the Georgia Trauma Foundation, investing in trauma care to save lives. Olansky Dermatology and Aesthetics, offering the highest quality in medical, surgical, and cosmetic dermatology. Avant Gynecology, Atlanta's GYN and surgical specialist. Virtual imaging, EBT screening for cancer and cardiovascular disease. And thank you for joining us for this half hour, the last half hour of the Weekly Checkup. In the studio, we have Mike Warren, who is a patient advocate at Virtual Imaging. And Mike, I love testimonials. I think it really drives home why it's so important to go get a scan at Virtual Imaging. And we've given a couple your own, and one about a brain scan earlier in the show. Do you have any more for us?
Yeah, so for the people who want to get some idea of maybe how important it is to take us up on our promotion today, which is $9.95 for this core body scan, just call 770-678-SCAN. One of the things we're going to do as part of that is the coronary calcium score. And the regular listeners of WSB who hear our promotions on your station probably have heard a lot about the coronary calcium score, but I do want to make sure people realize that that's part of it. And you'll also get a radiologist prepared report that shows the other organs in your body. But that calcium score report identifies heart disease all the time. In fact, we had someone that used to work for Virtual Imaging that was getting regular scans, and his calcium score jumped 400 points.
In what period of time?
In 1 year.
Ooh.
And by the way, any score over 300 is considered a high calcium score. His score jumped 400 points. That was just the amount of increase in a year's time. He went from 1,000 to about 1,400.
Oh, wow.
It's starting to get pretty serious when your calcium gets that high. He really did not have any symptoms other than fatigue, which he would have never attributed to heart disease. That is
I would
a common
attribute that
symptom.
to getting older.
It's exactly right, and it's a common symptom of heart disease. People don't know that. They're not drawing the line, or they're not connecting the dots between the fact that they're tired and they have heart disease. But he was able to get that addressed before it became serious. He got a heart stent, and he's repeatedly told us that he felt like a brand new person, that all of a sudden he had all the energy that he had been losing over the years and didn't even realize it. And that's the thing with symptoms. They sneak up on you. They become your new normal. You don't recognize it as symptoms of a disease. You just think it's a sign of aging.
For so long, it's kind of crept up on you. It's kind of like the frog that starts out in the cold pot of water, and then you turn the heat up, and then it's boiling, and then the water, the frog is in a boiling pot of water, and it doesn't realize it.
Exactly right. And that's one of the things that's an issue with symptoms. You don't necessarily make the connection that this is my body telling me that there's something wrong with me. This is my body telling me that I'm just getting older, or that I'm tired, or that I'm working too many hours, or I'm
walking up the stairs and I'm short of breath. Well, I'm walking up the stairs.
Or I'm not getting enough sleep. But a lot of times that's how symptoms work, that even when you have them, you don't recognize them for what they are.
Right.
And another story I'd like to share, if for people who think that symptoms is going to deliver them, that's going to be how you will find out when you have a serious problem. So I had a guy who came in one time who, on his scan, discovered an adrenal gland tumor Now, this is a small little organ that sits on top of the kidneys. But we found this thing, and by the time it was discovered, it was 6 inches in diameter. So this
6 inches.
6 inches in diameter. This thing is somewhere around the size of a grapefruit. Now,
Oh my gosh. Did he have any symptoms?
no symptoms whatsoever. Fortunately for him, it was completely encapsulated. They were able to cut it out, and he was fine. He didn't have to get any follow-up treatment. But he had no idea.
Did it stick out?
If it did, he didn't realize it because it would have been in his back because,
Okay.
again, the adrenal gland is on top of the kidney, so it wouldn't have been in the front of his torso where he
Right.
would have been more likely to see it. But it's just an indication that you can have something that big inside of
And
you
not know it.
and not know it and still not have symptoms. And just another example of why you do not want to wait for symptoms and why you want to take advantage of this core body scan for $995 so that we can go in there and tell you exactly what's going on.
You know, you said earlier in the show you've seen runners, marathon runners that looked in the epitome of health that were about to kill over from a heart attack.
Right. There's no guarantee. It doesn't matter if you only eat kale and if you run 5 miles a day, there's no guarantee that you're going to be in good health because one of the components of this, as we discussed earlier, is your family history. A lot of what goes wrong inside of the human body is pre-programmed. It's due to genetics. But yes, I have met with literal triathletes who had serious health issues. I've met with people in their 30s and 40s who had no reason whatsoever to believe there was anything wrong with them. They had no symptoms. They looked perfectly healthy, but looks can be deceiving, and I've learned that you don't judge a book by its cover.
Right. And you don't know what is going on the inside until you take a look. And that's where virtual imaging comes in, folks. Get your scan. We're offering a scan, a core body scan for $995 for an individual. If that's your cup of tea, please call, get the scan for $995. But they have a myriad of other scans that you can take them up on. 770-678-SCAN. I remember a nurse, I'm just pulling this off the top of my head, a nurse who went to the gynecologist, was having felt something wasn't right. I don't know if she was dismissed or not, but kind of had a sixth sense. Then went to virtual imaging and had some type of female cancer. Do you remember this story, Mike?
Not specifically, but it sounds an awful lot like a number of other stories that
I think
I've
we
heard.
had her on the air. I'm drawing a blank on the specifics, but because she came to virtual imaging, they found her specific. It was ovarian or uterine cancer.
I probably talked to about a half dozen people with the similar stories. And that's one of the things you learn from doing this. So I meet with people who come in for promotional scans like the one we're talking about today, but we've got 12,000 members, and patient advocates meet with them every time they come in.
Right.
And I'll say that there's probably, since I've been working there, not a week that's gone by that one of our members hasn't told us a story like that and told us that we've saved their life.
I can't imagine what that feels like.
Oh, it feels great. And we're going to save someone's life today.
Yes.
Someone is going to take advantage of this promotion today, and they are going to live to see their children graduate from high school, walk a daughter down the aisle, because they came in, because they were proactive, because they became their own health advocate and discovered that they had a serious issue for which they had no idea.
That gives me chills. I mean, folks, I have a family history of heart disease. My dad had his first heart attack when I was in college. I watched him have his fourth heart attack, and then he passed away of a heart disease. This is so important. Please call 770-678-SCAN. That's 770-678-SCAN for your core body scan. $9.95 for an individual. You save $1,500, and I can't imagine that your health is not more important to you than $995. Do it for yourself. Do it for a loved one. And they have brain scans that we've talked about.
We do. We have any number of other types of scans, but the head scan will take it above everything above the collarbone all the way to the top of your head. It's a comprehensive neurological evaluation. We're going to evaluate your brain, your skull bones. We're going to look at your sinuses. We're looking for signs of stroke, dementia, bleeding, fluid buildup, brain aneurysms, any number of things that can go wrong in the head. I always tell people that come in that the core body scan, which is the torso, I refer to that as the funeral home scan because that covers most of the stuff that's going to send you to the funeral home, and I refer to the head scan as the nursing home scan because that
Mike,
covers
you're terrible.
most of the stuff that's going to send you to the nursing home. But we want to try and keep you away from both of those places.
Okay. All right. That's 770-678-SCAN. That's 770-678-SCAN. The core body scan, folks. When we started this segment, we had 14 scans left. They're so busy on the phones that they can't give us another number. But when these scans are sold, they are sold. $9.95 for an individual scan. And this is from the collarbone to the pelvic bone. And we have payment options.
We do. There are any number of ways that you can pay for this, just about any type of credit card. But we want to remind our listeners that we are HSA, that's a health savings account, and FSA eligible, flexible spending accounts. Now, one of those, I believe it's the FSA, the benefits don't roll over. Most people who have these programs realize it, but don't let those benefits go to waste. Use them for something that can save your life.
Absolutely. Okay, folks, and this can save your life. You've heard it over and over today with the different testimonials that we've given. We have 15 minutes left or so on the show. 770-678-SCAN for the core body scan, $9.95 for an individual. And we're going to take a break. We'll be back with our final segment of the Weekly Checkup. I'm Belinda Skelton with Mike Warren, only on the Weekly Checkup on WSB. And we're wrapping up another edition of the Weekly Checkup, presented by Wellstar Health System. Thanks to our friends at Virtual Imaging for joining us, and to Mike Warren for being in the studio on this Sunday afternoon. Mike, we really want to drive home this promotion because this is it.
Yeah, this is your last opportunity. This is a core body scan for $995. The normal price for this is $2,500. So this is a $1,500 savings. This promotion was supposed to come to an end in June. But due to overwhelming demand, we shut it down, and then we got more and more calls, so we decided we were going to open up a few more slots for July. We started the show with 32 of those slots remaining. The last time I checked in with the call center, we only had 14 left. I'm not even sure if we still have any left. But if you want one, call right now. 770-678-SCAN. This could be your last opportunity to do this. This is not a perpetual promotion. This is not something that we plan to continue.
Right, and it's so important. And if you garner anything that we've talked about today, it's to be a self-advocate for your own health. No one's going to care more about you than you.
No, and you need to be proactive. As we've discussed many times, you've got to get ahead of the symptoms. If you're waiting for symptoms,
then you're probably behind the curve.
It's very likely going to be too late by the time those symptoms appear. And like you said, being your own health advocate, you probably have a great doctor, and I'm not here to disparage anyone in the healthcare industry, but he or she has a lot on their plates. They've got a lot of patients they're going to have to take care of. No one is going to care more about your health than you.
You can't walk into a hospital and say, or anywhere else and say, I believe I'm going to get a full body scan today, but you can at Virtual Imaging.
You can do that at Virtual Imaging. The only way you're going to do that at a hospital is with a doctor's referral, and the only way you're getting a doctor's referral is if you're sick or symptomatic. So, no, that's not going to happen, and especially a full body scan.
Right.
Even if you are sick or symptomatic, they're not going to scan the whole body. They're going to scan whatever is specific to your symptoms.
Right. And this is just a terrific way to know what is going on inside your body. 770-678-SCAN for the core body scan, $995 for an individual, $1,500 savings. Mike Warren, thank you so much for joining us on the Weekly Checkup.
Thank you.
All right. I'm Belinda Skelton. This has been the Weekly Checkup. Be well.